L was particularly interesting about microdosing, Botox, and filler. I think in a way, though, we do that here in the practice, which is interesting.
Microdosing of Botox, when they say using smaller amounts in many areas, we always do a microdose. We customize it for the patient, and we try to give less rather than more, because since we treat and document and even charge by unit, if we give a lower dose and the patient needs more, it's always easy to add more.
And I think in terms of the filler, you see a lot of places that are putting in large volumes of filler at a time. I think that, sometimes there is a time and a place for that, but for the most part, I feel like you and I always err on the side of caution with that. We start with, a couple syringes and we'll see how it goes. The patient can always come back for more.
See, I don't understand or agree with the recommendations from some of the manufacturers or some of the other, well-known teachers, where they say you need to put 4, syringes of filler in a cheek.
It's a lot at one time.
And that just makes patients, I think, look like those sort of weird social media pictures you see on Instagram.
And that's why people don't
Facebook.
Always want filler.
Right. It's given filler a sort of a bad name. So again, as we discussed with Botox, it's better to give less and you can always give more.